Now, today we have got a fantastic colleague of mine, Dr. Soumya Lanka. She is a uh, specialist in skincare, hair care, and she's the GP nearby me. Hi, Soumya. How are you?
Hi, Prakash. I'm fine. Yes, thank you. Thanks for inviting me.
Hey, it's my pleasure. It's my pleasure, Soumya. Soumya, you have been working as a specialist in skincare and hair care for a while. I thought that I will use your expertise in passing on the information to the general public who are in need. Is that okay?
Yeah, that's definitely fine. Yeah, go ahead.
Fantastic. Okay, let's jump straight into the topic. Now, coming to the skincare, Soumya, what are the fundamental principles of good skincare routine that everyone should follow? Is there any basic skin routine that is suitable for most people that you advise?
Basically, every skincare is different from every skin type, basically. But then I think the steps to follow, that's cleanse, tone, and then use certain other products, will be most of the time similar to most of the skin types. But then
Okay,
what the condensed in those individual ones differ from one to the other. Yeah.
everything will be different. Okay. Now, in order to understand, I think there might be various skin types depending upon the individuals. Are there different kind of skin types that we ought to know? And is there is any one particular skincare product that is tailored for majority of the skincare?
Yeah, if you categorize skin into oily and then dry and sensitive skin and combination skin, it's easier to kind of, use most
Okay.
of the products accordingly. Yes, yeah.
All
So,
right. So, what are the common skin issues that people face?
so it's again, as I told you, the skin type itself. It is this. They kind of mention to you it's the oiliness. Some people don't like it excessively oily. When it's too dry, you have to keep it moisturized. And when it's sensitive, most of the time, sensitive skin is as a result of not having a good skincare routine and the barrier is already broken. That's when it becomes more sensitive. And
All
a
right.
combination is like the T zone is oily and the rest of it is dry. Most of the time, those are the similar, simple
All
types of.
all right. Okay. So, are there any universal ingredients or products that are available that could fit for majority of the skincare type people? Any universal product, like all in one kind of stuff, or no? It is tailored made.
No, it's going to be definitely different for different people because there's no all in one made for anybody. So, because anybody with oily skin, they want to try and neutralize the oils production basically. So, you don't want something which is going to make it more oily. So, you need
Okay.
to use products with cleansers which are made with salicylic acid or azelaic acids. So, these actually neutralize, it helps you to get the skin what they want if it's oily.
Okay.
So
All
it
right.
just normalizes the overproduction of oil.
All
And
right.
whereas if it's dry, you don't want to use those acids on the dry people because it makes the skin very dry immediately, even after washing the face. So you want to use some gentle products without any acids in there.
All
So
right. Okay. All right. Okay. Now, do you see any seasonal changes as regards to skincare is concerned? Like uh, here in UK, every season will be having a different effect on the skincare. Is that true sense or is it not true?
it is very true because season change and your skin changes, your hormones change, your skin changes, you stress, the skin changes every time. The skin changes every time. So you have to listen to your body and your skin basically and change your skincare routine. I would say most of the time it's better to change your skincare routine every 6 months to a year so your skin gets something new to produce the same effect of the glow and everything on and off. So with respect to summer, if you think about it, it's quite it's so the amount of skincare we use in summer is very different to winter. So
Okay.
in summer, we always ask you to use a lot of sunscreen on top every 2 to 3 hourly, so that you
Okay.
don't get the sun damage. And at the same time, it's mainly the sunscreen which plays a very important role in case of summer. And in winter, again, it's the moisturizer, but at the same time, you need the sunscreen every day, even in spite of you sitting at home. You have to put the sunscreen on 50 SPF every day, any time of the year.
All right. Okay. Now, that is useful. Okay. Now, coming to the effect of age on skincare. How does the skincare evolve as a person ages, and what considerations should be taken into account at different stages of life?
Yeah, so that is a very important question actually because age is a very important factor in using the skincare. If you're on the right product starting from 20, I emphasize the age of 20 because after 20s we don't produce much of collagen. So collagen is a kind of protein if you think about it, which is
Yeah.
produced in the skin by cells called as fibroblasts. So they produce a lot of collagen. So they stop to produce collagen from the age of 20, and that's when you need to start introducing different creams at different stages. So you
Okay.
definitely need to be using a proper cleanser, toner, and a moisturizer and a sunscreen. That's basic for anybody. But
Okay.
what is involved in those differ from skin to skin. So in your 20s, I would always recommend a very strong antioxidant. So as an
Okay.
antioxidant serum. So you can that can be a vitamin C serum or a vitamin A serum. Okay.
Okay.
So after you cleanse your face, if you have a dry skin, you'll be using a gentle cleanser, and if you have an oily skin, you'll be using an acid-based, wash basically. And
Okay.
after that, you'll have to apply a serum.
Okay.
So serum is something, which is thinner. So I would always say go on to the consistency of your cream. The one which
Okay.
is thinner goes first on your skin. The one
Okay.
which is thicker goes later. And the last product on your face is your sunscreen, and you can put your makeup on top of it if it was a girl. Yeah.
Right. Okay. Right. Okay. So, uh, in these transitioning decades, as you mentioned, you clearly mentioned about what are the things that one can apply in order to prevent any further damage that is going to happen. Now, uh, how does this evolve in the 40s and 50s? When at the 30s, you can do the preventative skincare, but in 40s and 50s, as the age catch up, are there any role of any Botox play in the preventative measures of aging skin?
Yes, there is definitely because remember when it comes to skin, you've got epidermis, which is the outer layer, and then you've got the dermis, which is the layer just below it, and most of the changes happen in the dermis. Okay,
Okay.
and then
Yeah.
there's a fat layer, and then there's a muscle layer.
Yeah.
So as we get older, so there's a lot of stress. We all go through stress every day. So frown comes as a part of it with an emotional, response to another person.
Yeah.
So more the stress, the frown lines gets worse. And if you
Okay.
smile more, the crow's feet gets worse. And
Okay.
if you're raising your eyebrows, your frown lines, sorry, your forehead lines get worse.
Okay.
So it's almost like the muscles have to be handled at the same time as skin. Okay, so
Okay.
there's also a different layer, which is your fat, which is
Okay.
so important when it comes to fillers. Okay,
Okay.
so skin you can handle with skincare or with ultrasound treatments. But when
Okay.
it comes to muscles, there's nothing else which can do it as relaxing as it's only the Botox which can relax your tensed up muscles basically.
All right. Okay. Can you explain to me as to how Botox works in addressing the signs of aging, and at what age do you typically see individuals seeking Botox treatments?
So typically we see most of them in 30s they come for Botox, but then
30s.
yeah,
Right.
30s
Okay.
as well.
Okay.
And some in their 20s as well. There's no age group where, if you're overusing your muscles at the
Yeah.
age of 20, that means you're overusing it. So you need to try and relax those muscles or to retrain the muscles to relax themselves. So that's what
Okay.
Botox is trying to do for you. It's not
Okay.
something you inject and it spreads in the body. It just stays in that muscle and it works well for that muscle to relax it. So
Okay.
people come even in their 30s as well. But if they don't need it, I would definitely not recommend that at all. So there's nothing like you can start with a very mild dose of Botox. Yes, there's something called as baby Botox that people do with the
Okay.
first sign of overactivity in the muscle. So
Okay.
it's up to the individual, but I would say the right age might be like 30s, or it again depends on whether you're an Asian, whether you're, the Fitzpatrick type of the skin makes a lot of difference.
Okay.
So, and the amount of collagen synthesis. So we belong to type 4 skin. So type 5 skin has got so much of collagen. So
Okay.
they use very less of fillers and Botox. whereas type 1, 2, and 3 might need the Botox earlier on because it's the way how the genes have been since a very, very, very long time back. Yeah.
Right. Okay. Is there any specific age limit until which point of time you will tell that there is no need for giving Botox or anything at all? Any upper age limit or anything? Or people can have this Botox injection at any point of time in their lives?
Any point of time, if your muscles are overactive, that's when I would say please go ahead and have it. If it bothers you, if it doesn't bother you, please leave it well alone. But otherwise, if it bothers you, yes, so you can treat them. And my oldest patient is 92, so she's
Wow.
still, and she's got a lovely skin, so there's no upper age limit. So it depends on how you want to keep yourself looking. Some people are fine to accept how they are, and there's
Sure.
some people want to just try and age naturally, just using skincare products
Hmm.
and HIFU ultrasound or facials. So, and
Yeah.
some people want to meddle with a layer more below the skin, which is muscle
Yeah.
and fat.
All right. Okay. Now, when you give a shot of Botox injection, how long does the effect of it last for?
It will
Approximately.
last anywhere from 3 to 4 months, I would say. So
Okay.
after that, the effect of the Botox wears off. Even a third month, the effect wears off. But I would prefer to do it every 4 monthly. It
Okay.
again depends on the type of Botox. There's so many types available at the moment. There's
Okay.
type A and type B toxins. And
Okay.
again, what we use is a different type. So most of the time, it's 3 to 4 months. Yeah.
Fantastic. Yeah. And in addition to the Botox, do you offer any complementary skincare products in addition to Botox for your patients?
Yes, because remember what I told you, it's different layers of the skin. So there's no point in treating because when we get older, the first structure, what loses, what shows up first is your skin, then
Yeah.
is your muscle, and there's bone resorption as well as we get older. So that's where 40 and the
Yeah.
estrogen comes to place. So it is very, it's quite, I would say it's a combination of things that we need to do. It's not
Yeah.
just Botox. A person, if they come just for Botox and not using skincare, it's not going to serve the purpose. So it's better to do all of them together. Yeah.
Fantastic. And to finish off the conversation, one last question. Are there any complications of having or taking this Botox injection on a regular basis? Anything at all?
Nothing much. If you're under the person who has done the course properly, if they understand your muscles properly, and to understand not to alienize a person, to make them look like how they were before, that is quite important because you don't want to distort the face what they had and what they naturally have. So I would say I have never seen anybody come back and say they've had complications if that's being done right and into the right points of injection, basically. Otherwise,
Oh,
yes, there is a chance.
fantastic. Soumya, that was really kind of you for have accommodated and given your valuable insights regarding skincare and regarding Botox injection. I really appreciate it. Thanks for participating in this video blog. Thanks, yeah.
No problem. Thank you.